So Dr. Kenyon, just real quickly, she serves as the director of the clinical training and associate professor for the Masters in Clinical Counseling program at Point Loma Nazarene University. She is an AAMFT approved supervisor who has 15 years experience as an educator and supervisor in the fields of clinical counseling, marriage and family therapy, and clinical psychology. Dr. Kenyon was trained by Abanino, PhD, in the person of the therapist, POTT, which she is presenting today. It's a training model. She's developed a structured clinical skills lab, which integrates philosophies of the POTT model and has been used for development and remediation in training therapists. What a spectacular background, and so glad that she's part of our team. Yeah, let's clap for her. Sheldon, you wanted to do that. So thank you so much.
Thank you. Thank you, everyone. So welcoming. I'm going to lower this because I'm not as tall. All right. Well, I'm excited to bring this to you today. The actual POTT training experience is a several months intensive training. So in 1 hour, we are only going to focus in on one particular area, which is the signature theme. And I'm having you figure out how you can use that as your superpower to be a better therapist and clinician. So the learning objectives, this is not allowing me to click forward. All right, learning objectives where you'll be able to identify how the POTT model approach is different from the typical approaches to countertransference. Develop some understanding of your own signature theme. Yes, we'll have you delve in a little bit today. And then also describe the POTT model's components of knowledge, access, use. My learning objectives goals are really just having you get a little more awareness of how your kind of God-given perfectly imperfect therapist role can be used in therapy and actually can be like honored versus something you feel you have to hide or push aside. So I'm excited. So with that, I would like you to take pen and paper. If you want to use like a tablet or even your phone to note, that's okay. We're just going to do, there's going to be multiple times where you'll be kind of noting some things because I want you to have a little bit more kind of integration internally of this information. So the first part is I want you to write for 2 minutes on your responses to these 2 questions. So what messages did you receive from supervisors and educators about countertransference? And how do you handle countertransference when it rises in a therapeutic encounter? If you have yet to be in a therapeutic encounter, how do you think you will handle it? All right, so I'm going to do a timer to keep us on track, but just 2 minutes and reflect on that. All right, please wrap up. Now I actually want to invite you to be able to interact with somebody next to you and be able to pair and share. So I want you to take 2 minutes in pairs, sharing the messages you received, as well as in the Zoom, we have breakout rooms for you. So if you can join your assigned breakout room, we've kind of randomly assigned them, that would be great. Well, I can tell there was a lot to say about this, right? This is something where it's talked about in our field a lot. So for those of you on Zoom, if you want to put in the chat, just a note about what your pair talked about, you're welcome to. And then here, if I can just have a couple of people volunteer some of the messages you received about how to handle and what to do with countertransference. Yes. Consultation, there we go. Somebody in supervision knows what to do. You consult. Yeah, no, wonderful. What are other messages?
Don't ignore, pay attention, like notice, pay
Yeah.
attention to, don't ignore.
Yeah, be aware of it. And yeah, wonderful.
It's bad.
It's bad. Just straight, it's bad. Exactly. Countertransference bad. We can't have it, right? But we all do. So it's like, what are we supposed to do? We're all bad, right? So, Selena, anything on the Zoom chat that adds anything more? Okay. So with that, overall, I would say the messages kind of fall in 3 categories. We have be aware of it in session, manage it out of session, or overcome it in your personal therapy, right? Does that sound about right? It's like, notice it in the session, And then don't make sure it's not coming in and interfering, and then manage it out of session, journaling, consultation, supervision, talk to people, and then overcome it. Like, we got to overcome these countertransference reactions because it's part of our continued areas of development, right? So I'm inviting you today to have a different approach. So my invitation for you is, oops, it went, yeah, to use it as your superpower. So doesn't that sound a lot better? So what I'm going to share with you is the POTT model, which is a actual structured way of using it in yourself with a therapist work to better your clinical interventions and attunement to your clients. So this was developed in a brief overview by Harry Aponte. He's a family therapist with a psychoanalytic background. He worked with disadvantaged families, and he attends to spirituality and culture in therapy. And the POTT model, gosh, this is very sensitive. The POTT model, philosophical premises. One, it's a common factor framework. So basically, we know that 15 to 20% of outcomes are based on the therapeutic relationship, regardless of theory and all that, right? This is really focusing on that therapy is first and foremost a relationship. This is not a theory to use. This is not a model of clinical interventions. It's not you use CBT or the POTT model. You use this or that. You actually are integrating the POTT model in the work that you do from whatever theoretical perspective you come from, which is another lovely thing about it. Aponte was influenced by Henry Nouwen's Wounded Healer. And really the idea is you come as you are, not as you wish you were, right? We talk about beginning therapy and going, oh, I thought I worked on all that stuff. And look at that, I started seeing clients and the stuff is coming up. I guess I have more work to do, right? And that's the how you wish you are. You want to be there of like, oh, someday I'll get rid of that, right? We, in the field that have been here, I'll give you a little secret. We have some that have even been there more than a couple of decades like me. You don't ever fully get rid of your stuff. So why not use that, right? So let's look at that. In a nutshell, the POTT model is having therapists intentionally utilize their entire lived experience with special focus on emotional vulnerabilities, that woundedness part, and in the POTT model, it's called your signature theme, to better empathically attune to clients and then direct your clinical interventions and treatment. And so that's the part where I want to show you how we can kind of today get you a little more aware of your signature theme, okay? So the signature theme, there are some common core issues that you may come across. Fear of rejection, need to control, lack of self-worth, fear of being vulnerable. However, those are like big, broad categories. What it really narrows down to when you're talking about your signature theme is your personal signature theme. Often, I am this because of this. So I am worthless because of these things, or I'm not good enough. I'm flawed in some way, that type of thing. And so really, this is not just what shows up in our therapy room. This is central to all of our interactions, our relationships, how we manage situations under stress. What happens outside of the therapy room with your signature theme is also what can be coming up in the therapy room with your signature theme. So becoming more aware of it helps you to notice it and use it effectively versus feel like, oh, I have to push that down and get rid of it. So here's some sample signature themes that are a little more specific from some first-year MFT students. This is before they ever did any clinical work. So uncovering their signature theme, one is like over-functioning and abandonment issues. I'm also afraid to be vulnerable because I see it as a sign of weakness. Fear of rejection, not being good enough. And then somebody where they're saying they realize that the most of the tension and anxieties and coping mechanisms that are part of their life today are centered around the need to be in control and how they react when they're not in control. So these are all things that you can see where you're like, oh, this could bring up things in therapy, right? You're the therapist and you're going, oh, I need to control. And then this feels out of control because this client is going in this direction. I have this plan for my agenda. You may pull it back and be much more structured, right? So that's a way that it could actually be possibly damaging or hurtful in the therapeutic relationship. But I'm inviting you today to see how it can be powerful in the therapeutic relationship. So with that, before we talk about how we apply it, I want you to get a little more into what your signature theme might be. So I give my informed consent. So privately, you're going to be writing and reflecting on your signature theme. You will not be asked to share it, and I also recommend that you not volunteer that information, that you just have that be where you are uncovering it. This is new for you, and you don't want to kind of overshare and then be like, oh, I wish I hadn't said that. So just not to volunteer it. Be mindful of your current capacity to reflect on your woundedness and participate to the extent you feel comfortable. Whatever you need to soothe, regulate, standing, stepping outside, doodling, deep breathing, you can pretend that you're writing about that and make your grocery list. It's okay, whatever you feel like you can do right now. I understand sometimes we're not at a capacity to delve into that, but honor that within you and really recognize. So take a moment while I send you through a couple of prompts to reflect on these. Each one is going to be like 1 to 2 minutes on it. So you could later on develop it further, but just want you to kind of touch on that and go from there. All right, so the first one, what is your biggest source of anxiety and or biggest fear? So examples may be being abandoned, rejected, not being good enough, feeling stupid, etc. But the list goes on and on. All of us have our different types of fears. And just take a minute or two. All right. The next one to prompt you is there a characteristic of yours that somehow limits you in your functioning and relationships? So here's an example, not wanting to be needy, so pretending to always be strong and independent. As a result, you're never asking for help and feel alone when faced with a crisis. That is obviously an example of somebody else's. For you, whatever fits for how you maybe are limited in your functioning and relationships that you're aware of. Take about 30 seconds to wrap up your thoughts on this. All right, and our last prompt for today. Looking back at your life, can you recognize a recurrent pattern in your functioning and relationships that doesn't work well for you? So using what you've already been kind of uncovering and putting that together, maybe a pattern that you're seeing in your life. About 30 more seconds to wrap up your thoughts, please. All right, so set that aside. We will have you just kind of look back at it later when we kind of debrief at the end. But wanted to just have a moment where each of you can kind of reground and bring yourself back. Sometimes reflecting on that is really a kind of a challenging place to go to. And I commend you all for being willing to go there, but honor that it's like, okay, now I need to kind of reground and bring myself back here. As I mentioned, there are ways that you could see some of these recurrent patterns coming out in a therapy room in ways that actually maybe veer the client away from what they need in that moment, right? So if you're uncomfortable with emotions in some way, then if it goes into the deeper emotions with your client, you may pull them out sooner or veer them away with maybe the guise of thinking, oh, they weren't ready to go further. I didn't want to push them too hard, right? That can happen. Sometimes we're honoring our clients and other times we're honoring our wounds in our own signature theme, right? So you can see how it could have where those signature themes can come into play in a way that could derail things. But what I want to show you is a very quick way of showing you how you, in using and uncovering the signature theme, can actually start to use it to empathically tune to your clients. So this part could be an hour in itself. So I'm going to just kind of go over it briefly, but want you to start thinking about using this. And if you are a supervisor, maybe there's ways to help your supervisees get in touch with their signature theme and how that plays out. If you're in therapy, doing therapy, you can actually then start to figure out, how can I use this? What can I do here? So first is knowledge. That's the signature theme. Now, what we did here is a small portion of that process even, because the full training model is, this is a very developed paper. There is actually where you have with the facilitator a discussion about your signature theme with the rest of the members there in kind of a half circle. And everybody is there in a way that is not about, let me respond to that person's signature theme and what they shared, but really checking in for that full experiential, what came up for me. As they shared this is what came up for me. So it still is always about you and do that. And so that process is, and then you redo your signature theme with reflections based on that conversation. Like, it's a really powerful part of it. But in a kind of shorter way of doing it. Here you get a little bit of a sense of what might be going on for you. So what you know about this, when you're in the therapy session, you're like, what do I know about this? That client's talking about kind of feeling unworthy or something, right? It's like, what do I know about this? Like, I'm gonna think about that and like, maybe cognitively anchor myself in what am I aware of that relates to what this client is sharing, right? But that's not enough. That's the part where it was like countertransference. Be aware of it, set it aside and deal with it later. Right? So we're saying, we want you to access that. So there's the accessing it from just dipping your toe in, not accessing it of like, I'm fully going into that feeling of being unworthy and how I feel flawed all the time and I present this way so people don't see that. It's like, no, you are then like in your own head and you're not present in the therapy room, right? But you tap into it. So you kind of evoke but not engage the wound and you're like, okay, I remember that feeling. It's full body experiential of like, I know what that feels like. What do you remember thinking, feeling, doing, body sensation, all of that? Because if you can tap into that, you're there with your client in the attunement of this is the depth of the feeling of what they're experiencing. So we tap into that and then we use it. So we have to identify and then differentiate. It's not my story, it's my client's story, right? So we're recognizing how is this connected to what my client is experiencing and how do I apply it clinically? And I want to give the caveat of applying it clinically doesn't mean self-disclosure. You can let your client know that you are attuned and you understand in all levels of your being what they're going through without ever sharing why you understand. And I think that's important to know. Sometimes people are like, I can relate to being unworthy and I've had experiences that, and it's like trying to connect, but that's not what we're talking about. Sometimes self-disclosure can come into play, but this is not what the POTT model is. I mean, it's really about you are experiencing it. And then whatever feels like clinically the best next step, you do. So that might be where you're like, I'm just going to offer a reflection that takes it to the next level. They're talking about feeling stressed and upset. And when they're describing the situation and you're like, what do I remember feeling in this type of thing? And you tap into it, you're like, oh, I was defeated. I felt like I was in a dark space, right? So if you reflect that, or you use metaphors that kind of come to you in recognizing what does that feel like, you can very much attune to your clients more. And then you have better judgment of what do I need to do next with my client. So I invite you to start trying to do this, but if you're in supervision, work with your supervisor on how to do that. And then recognizing even before you're in a therapy room, how do I start to pay attention to when my signature theme arises? And what happens when it does arise? Often we go to shame. But shame doesn't connect us to people at all. We all know that shame disconnects. So we want it to be where we're aware of the signature theme and this is what's coming up for me. Oh, I can understand. And maybe it's coming up because I'm responding to something in the relationship of outside of therapy, of what's going on there or what I'm noticing here, or I'm stressed, right? So being aware of it and building a little more compassion for yourself and others because of that. And then in the therapy room, being able to connect that in a way that really attunes to the clients, you're here with me, you get it. Right? So with that again is just a little piece of how you can start to use it, but is an important way. My colleague, Kelly Shearer, that's going to be presenting after this, she and I developed clinical skills labs that because we didn't have the full training of the POTT model, we had components that in live role plays, we could integrate moments in. And these are kind of the ideas of the questions. So that's what we have here for you is like questions to kind of take them through that process. Usually it's kind of like pause it and then tap into what are they noticing right now? What do they know about this? What does that mean? So this is kind of the question piece that we developed. Any questions on the knowledge access use? Again, I know we went really quick through that part. All right. So with that, what I'd like to do is just show a little bit of information about what research has found benefits. So POTT model benefits. So in clinical work, there's been reported a positive impact on establishment of therapeutic relationship, of clinical judgment, tailored interventions, and overall improved clinical work. So that's what they found in their clinical work. That's the reason you do this. I know as therapists, we're like, oh, we just want to know about you and learn more into, but it's not like, let's uncover this and then be like, okay, that's it. The whole point to do that, especially in like an education supervisory setting, you're not their therapist, for the understanding of how do you use this clinically. Otherwise, we're just, going, oh, well, we just want to like look into your world and like get, peek behind the thing and be like, oh, that's what's going on. Okay. It's like, how do we use it is really the goal. So with that, this was what they found from some research. It's clinical work. But what I call kind of the side effects, the unintended consequences, because this was about, can we make it so they do better clinical skills? The students themselves had increased self-compassion and self-caring for themselves, self-acceptance and self-awareness, and their own personal growth. So they reported all of these things happening as kind of a byproduct of, as I'm doing this, these happen. And if you think about it, that compassion piece, when you tap into relating to an experience of your clients, and you're able to feel what that feels like in that moment, and then attune to your client and they're in that space with you. We're not judging our clients. We're not shaming them. When we do that, we're getting more and more empathy and compassion for them, which indirectly translates to, hey, if I can have that for my client who has these wounds and these experiences, I can also have that for myself, and understanding this is just part of my life. It's a way that like you may have where marginalized identities are like their stories or their experiences are like, oh, we can't put that in, that doesn't fit in mainstream, so we only talk about these. But it's like every person's lived experience matters. Every person's lived experience can be tapped into to be able to then use it well in therapy, so that it isn't where we're just saying, well, therapy has to be where these are the things that you address. This is how you look at, like, if you're looking just theory, like these are the things that you look at, right? It's like, no, you as a human being are in there in the therapy room. I don't have to tell you all that it's a spiritual encounter. Excuse me, it's a spiritual encounter. This is not just a job. We are going in there and we're going deep with our clients. So with that, I want to just take a few minutes to share a little bit of time together. And I wanted to, so this is where there's two parts to this that I want to have you do. So I want you to just take a moment, look back at the journal reflections and responses that you had, and really think about what you could find valuable with having uncovered that a little bit more, and what may be most challenging for you to use it. So I'm not asking you to share your signature theme at all, just thinking about it from a clinical application and a personal kind of awareness of it, of what that means, of like, how can that be valuable that I now know this? How could I maybe use that? And if you want to volunteer to share, you can. On Zoom, we can have them do in the chat or even raise hands and we can unmute. Whatever feels right, but take a moment and just think about, like, how is this valuable to me? Now that I've uncovered a little bit of this piece, how is this valuable and what can I do with that? And what might be some challenges? And you can speak to whichever one you want to, if you speak at all. go ahead and wrap up your thoughts, about 15 seconds. All right, if anybody would like to share some of their kind of insight around how it would be valuable or what challenging pieces you see, I invite you to do so, but no pressure. And again, on Zoom, if you want to either put it in the chat or raise your hand, we'll go ahead and unmute.
I can imagine that the evoking, not engaging portion takes a lot of practice. So evoking while staying present and not allowing it to overwhelm you.
Yes,
In a way?
yes, because you want it to be where you're like, I'm tapping into this, I'm not fully in it, because then it's like, I'm in it, I'm not with my client, and it does, I mean, it does require practice. I'm actually surprised at that it doesn't require as much as you would think. I mean, I'm still practicing it, right? So it's like, I mean, we're always practicing it. So I guess that idea of like, it doesn't require a lot of practice to be able to like start to use that and feel like, okay, I can kind of connect to that. I agree that if it's like you connect to your signature theme and you're really like emotionally unraveling, then maybe we work through a little bit before we use it, but it's still, that's the nice part is we use it to the extent we can. So maybe I'm not ready to tap into my signature theme and really kind of tap in, but I could tap into being afraid to go deeper. That's the part where you can then use it at that level. So that's the nice part, that come as you are, not as you wish, right? So it's like at whatever level, you're like, oh, I know what it feels like to be terrified to even go there. So that's where they can kind of tap into that. And it's not like they say, oh, I understand it, but it's like, it's terrifying. Just something like that could be powerful. That's where they get it. They know you get it and that you're attuned to them. So that's the piece where I love that it's like, go to the level you can. Like, we don't want it to stay head level if we can help it, but it's like, go to the level you can. And maybe it isn't where you go to the deepest, darkest ones first, you go to the others. I do encourage you to even just practice that outside of the therapy room, right? To kind of be where if the friend's telling you a story and you're like, oh, what do I know about this? How can I relate to that? How do I connect to that? Where it's like, oh, I'm not trying to do clinical intervention right now. I'm not in the therapy room, right? And your friend might be okay if you kind of like go a little bit more into like, oh, I'm in this emotional state. But I think that piece of really honoring that it's like, you know what, this is with us wherever we go. I've had people ask like, can you get rid of it? And it's like, in a nutshell, no. It's like it can change and transform and evolve and affect you in different ways and all of that, right? But the reality is it's a signature theme that's so ingrained and you'll catch it like the practice. I'm like, oh, that's what that is. Either my signature theme or my response to my signature theme and how I come out like towards people and world. And so it's interesting. Even Dr. Alba Nino, who trained us, even recently in our like POTT consultation group, she was saying something about like, she's never shared with us what her signature theme is. You don't have to, right? But she said something about like, well, with this, I'm noticing that my signature theme's coming up and I feel like this is, and so it's just one of those where it was like, we can talk about it in that context, but it's like, she is one of the people that helped develop and write the book on this. So if she's still going, it's coming up, then that tells me I am not going to get to a place where I'm like, it never comes up. That's okay. Harry Ponte would probably say, yeah, thumbs up. So recognizing that that's the part where we friend it versus it's our enemy. That's the difference. Like, this is my little like wound that's like, it's not a gaping wound anymore after you've done some of the work, which is great. We're not going, okay, we need to like get in there and sew you up, right? But we're going, well, that's my wound. Yeah, it's touching that point. And another piece to share is that it's not a event in your life, even though an event in your life could affect your signature theme and how you relate to the world. So does that make sense? It isn't going to be just all like, this happened to me, so then this. It really is where it's like this, and then it evolved, and then it's like, this is how I relate to the world as a result. And it's like, it carries over and evolves in different ways. Anyone else want to share what they find valuable or challenging about using the signature theme?
I was thinking that our signature theme, in my case anyway, has a lot to do with what our fears and our anxieties are, that I feel like as a clinician, I would strive really hard to not put my clients in a situation where they experience those things that I fear and have anxiety about.
Mhm. So in terms of not putting them in the situation, so tell me more about that. What's the part that you have, like, not wanting to put them in that situation? What's the?
So if I have a fear of being rejected, as
Mhm.
I am, then
Uh-huh.
I'm just gonna show up with my client and be so accepting.
And that's great, because it is that idea where you're like, okay, this person needs our love, and like giving us like giving that validation of like, you matter in all that you do. So I agree, like it may be where you're like, okay, I want to give that, but here's what might happen if we don't allow ourselves to stay with, reflect, and attune to that feeling first, of if they're like addressing rejection or something, we then may like pull them out fast and maybe be like, oh, they're rejected. But you're an amazing bird. Are you so? No, but well, I'm sure they didn't mean it that way. Like maybe where we're like, I don't want you to feel this because I don't like feeling it. So let's get you away. I'm going to fix it, make you feel better. I'm going to compliment you. I'm going to do all this to pull you out. So that's a part where you recognize, let me stay in it for a moment. This client's talking about feeling rejected. Yes, they need my love. They need my validation. They need all of that. But right here, they need to feel heard and connected to that pain. And that's where you stay for a moment, because then later you can help them move and process and go out of it. We too soon have clients go up to the pain and pull back, up to the pain, pull back. And that's what they do in their outside lives. We don't need to replicate that in the therapy room, right? And we want them to honor if they go to the pain, they stay with it, they process it, and they come out, that they're like, oh, I survived, I can do that. Right. And honoring that it's like, these wounds are who we are. So I agree. It's like, you could actually react the other way of like, oh, I don't want somebody to go through this because I know what that feels. But you also connect with that first and then allow them to do that. Yeah. And I think with that same piece, what comes to mind is when you were talking about as a therapist, fears and anxiety, I was thinking about being a beginning therapist, right? And you're like, I got all these anxieties coming up. I don't know that I can tap into like my signature theme. That's fine. But you can tap into, what is it like to feel scared? What is it like to feel like you don't know what you're doing? What is it like to feel like you might be found out? That's a beginning therapist experience that you can connect to, that a client may share. Our clients give us gifts all the time. My client yesterday actually talked about something about like, I do this and I do that, and I'm afraid if I slow down, that like she's going in this, she's really deep into it, and she's like, I'm afraid I'd be found out. And so we stayed with that, but then it was exploring, what is she afraid they will find out? And it's not about anything in her current life. It's about all through her life in different stages, things she had to keep hidden. Her dad's serious mental illness and his psychotic episodes, her own eating disorder, her own inadequacy, all of these things along the way, that now she's lived life, and she's near retirement, lived life as if, I'm afraid somebody will find out, right? Oh, I can relate to that. I can connect to it. Like, oh, that's terrifying, right? And so just different levels of it you can connect to, even if you're like, well, that one's not my deep signature theme because this is going on. I'm in the therapy room and I'm new and I don't know what I'm doing. So I'm going to just stay here. But it's like, if they're like, I feel lost, I don't know what to do. You're like, I can tap into that. I'm there right now. It's not that far off to tap into. So those are types of things that you can speak to at certain levels. Any other thoughts or reflections on these questions before we shift to questions in general? Anything on this? All right, so I'm going to open it up to questions. I have something to kind of share with you at the end before we wrap up, but I want to give adequate time for any questions that come up, because this may be pretty new to you to think about, and some of you may have heard of it. It's interesting to me. Years ago, I referenced to Self of the Therapist and a POTT in something that I was writing and did, and I came across that after I trained in it, and I was like, oh, I was writing about it, but I didn't get what it was. I was like, oh, that's just Self of the Therapist, right? And I'm like, oh, this is like truly like a model for how do you do true Self of the Therapist work. It's not just like be aware of it, self-care, all these different usual messages. It's like, how do you use it, and you allow your humanness to come in, your God-given, and humanness, and the wounds and all of the journey that you've had is important and valuable. All right, any questions on this one? And then same with Zoom if there's any questions.
So one thing I think about with the last thing you just shared is like, not necessarily compartmentalizing your job as a therapist, but rather taking your whole self into the therapy room. And like you said earlier, that doesn't mean like overly self-disclosing or kind of trying to work clients or anything.
Right.
But feeling like you can really go from one context to another, which is something to me that sounds valuable about this approach, is like not having to block parts of myself off necessarily.
Exactly.
It's an abstract thing, of course, in any like conversation with a client, you're not gonna, again, bring your whole self
Right.
essentially, but yeah, I like that.
Yeah, and one of the things they talk about in the model that speaks to what you're saying is it's like you use this to work with professional purpose. And that's the part where it's like you're still in a professional role. You still have to honor that it's not like, hey, it's a friend and I having coffee and we're chatting. Oh, I have that. Oh, this was my experience. Let's chat back and forth. Right? You're still the therapist. But being truly, genuinely you as a therapist, we talk about that to students and supervisees. It's like, be yourself, be you, and it's like, what does that mean? You with therapist hat on, right? Like it's not you with your friends on a Friday night, right? Those are different, but it's still you fully and genuinely you. And this is where, that's what I love. It's like every person's experience matters. And I, as a supervisor and educator, never want it to be where I'm just creating like cookie cutter versions of me. I'm like, no, I've seen like works by great therapists, and I'm sitting there going, I could never do that. I mean, I work from EFT model, and when I first saw Sue Johnson, I was like, yeah, this is amazing, but oh, that's not me. I can't, I'm not as gentle. I'm not this. And I'm like, okay. And it was when I saw somebody else do EFT, I'm like, oh, I could do it that way more. Okay, there's another way to do this, but I still don't do it that way because I have to do it my way, right? So recognizing it's like we use ourselves in that. And this is a way that you can actually more readily attune to your clients to then know what's the next thing that my client needs. Yeah. And being accepting of you where you are. Because I think so often as beginning therapists, they're in this mindset of, well, someday when I'll get more experience, somebody that's okay, oh, this stuff came out, I gotta work through that. I gotta get past these countertransfer. Oh, this, and it's like as if it's someday. That therapist I'll be someday. And the therapist you are right now in this moment, even if it's your first session ever, is valuable and meaningful. And if you connect to that attunement and that relationship, you will do amazing things. So. All right. Yeah.
Can you just repeat any questions?
Yes, thank you. Sorry. I was wondering how well it picked up, because are these the speakers here?
No, it's just.
It's only this. Okay, because I was thinking, I'm like, oh, they have that. Thank you for, yeah, then.
I wonder if there's is there this so beautiful. Is there a point at which it's almost like the signature theme, the amplitude, magnitude of the response, if you think about functional response, does get into the, okay, this is problematic for the client and for me.
If you're tapping into it to that, yeah.
Yeah, I wonder if there's an assessment process of that where it gets unwieldy, maybe because it's severe or not understood well enough, and is
Yeah.
part of the
Well, I think the idea with it is it's always about kind of self-evaluation, reflection, like you're trying to like check in and kind of see how we're doing this. And so regardless of if we are going into like reflecting and being deep with our clients, we have to know what's our emotional capacity within that. And so I agree, if something really is like, you're like, well, when I think about the signature theme, I'm unraveling, then it's like, yeah, maybe I'm not tapping so deep into that in the therapy room until I get a little more. But again, it's still where you can kind of go layers. You're like, okay. And so with supervisors, they can really look at it as one thing that comes to mind as you said that, it's like from an EMDR standpoint, they talk about when you're processing, 1 foot in the present, 1 foot in the past. And if you actually go too much into like you're reliving the trauma, then that's not what we need to like bring you back to the present. So I think that idea of in general for supervisees and therapists to like honor, like what's my own grounding? What are my ways that I know? How do I self-reflect when I know that maybe I'm going, like I'm identifying, but now I'm not differentiating. I'm going into my story and I'm staying in that. And I think there's a little bit of an art to it. That's the art and science, right? There's a little bit of an art to it, but I think overall, that's the beauty of this, is it doesn't have to be only experienced therapists do this and they can use it because now they've done all the work, right? It's like, this actually was developed for beginning trainees before they even started in the therapy room. And then once they did in the therapy room, the full model has where you do the signature theme, papers, the presentations, they have all these journal responses of like your reactions to things. And then you also have role plays, ideally with actors. A lot of times that may not be an option, but role plays with actors where you can kind of do that live and kind of see what's going on. And then you do it where it's with clients and doing clinical case presentations around the signature theme and showing videos. So that's kind of the model to ideally allow it to be that transition. So that's where it's built into the model in that sense. So I think if you bypass it, then you are kind of like, okay, well, how do I know that I can be present with that? And what amount do I do that? And that's where I think the friend, like doing it with your friends or family or other people, like tap into it and allow yourself to be like, huh, what's that experience like? The same thing with your friends. If they're telling their story, you can relate to what that feels like. But if you go into where you're like, and I'm going to tell my story, I didn't really hear that. It's like, that's the part where it's a good practice that's lower risk. Yeah. Great point. All right. Anything on, I see. And I don't think I repeated his question. Did I? Thank you. I'm sorry. It's like, okay. And was there something here? I see chat, but I don't see, there's no, yeah, perfect. All right. So with that, what I'd like to share with you is a poem. The context of it is a poem that's written about the therapeutic experience, in particular, what is revealed by a client as well as a therapist. And this author said, sometimes it's only poetry that can best convey the deepest and many times darkest feelings that arise through the transference and countertransference elicited in therapy, especially a therapy that has lasted over a lifetime. So she did a collection of poems and spoke to kind of over her years of therapy. And this poem stood out to me. The Therapy Patient. My hell is not too hard to find. It floats on the surface of my corneas and runs down the sides of my face, scaring those who won't look into their own rods and cones. My Virgil understands because his hell and my own floats on his corneas too. I can see it even though it is not discussed. I thought that was a beautiful way of looking at attunement, right? That nothing is even being said and this person knows that therapist gets this and feels it and is connected to it. This is ideally what we want with all of our clients, is for them to really feel like they are seen, heard, and understood at a level that maybe they never even had in their lives. Well, thank you so much. I do want to also let you know the POTT consultation group that I'm a part of, we are going to be presenting in a couple of weeks in Japan. Some of us, we're doing different presentations, but we are presenting at the International Family Therapy Association. So we had talked about a way to collect information for not students, but for participants that are interested. Because so often when we present on it, people are like, how can I get trained more? What do I, what is there available? And we are actually developing pilot studies now for if we can replicate this in a consultation model, if it's not a part of your education. So what I developed is a link, like a Google survey, that if you're interested in being informed of any training or consultation options, you can sign up for that. This link, we could share that with, you have like the people that were registered, you could send the link that way. Yeah. And then I also was thinking in the Zoom chat, if there was a way. Yeah. So with that, if you're interested in learning that, we're not going to bombard you with messages, but it was one of those where I'm like, you know what if we like start collecting that information so we can share once these pilot studies are run or after the pilot studies, and we're like, yeah, we have this model for you. Then it can be available. So that's what this is. If you're in the future, you want to learn about trainings, consultation groups, things like that, then we can have you on that list. And so it's a small group of trained POTT trainers who have actually who are affiliated with the POTT Training Institute. And so it's only us that would have that information. So I just wanted to get that information. And then if you want to contact me, feel free to. I am so grateful for being here today. It's such a blessing to share my passion and love with you all. And I hope that it's kind of sparked some ideas for you in your clinical work and in your life, and really building a little more empathy and compassion for yourself and what you carry in and day out, and all that you're able to do with that, right? That's amazing. So thank you so much. I appreciate it.
Okay, I'm gonna come up and I'm gonna first pray for us and just say thank you to Dr. Kenyon. That was amazing. I'm gonna pray for us just to bless this time and then share just a bit about what's gonna come next for those that can stick around. But Lord, thank you for this amazing day and just an incredible opportunity to learn. Thank you for Dr. Kenyon and her heart for her clients and for us and for you. And Lord, thank you that we have the privilege of being wounded healers, and that you are the great physician. And through all things, you redeem us for your good. And we are just so grateful that we have life in you. And we pray for our clients and those we serve and people that hurt. And just empower us, all of us, everybody in this community, to learn how to love like you. Thank you for this day. In your name we pray. Amen.